In this lecture, we'll be discussing personality disorders. You'll probably notice that I'll speak about these disorders somewhat differently from how I've been talking about other disorders. Generally, I focused a lot on the specific criteria. For personality disorders, though certain diagnostic criteria are needed for the diagnosis, I will speak more generally about each of these disorders in order to try to give you a bigger picture of what someone with each personality disorder might look like or how they would behave. Therefore, although I will discuss the specific symptoms, try to really integrate the symptoms to best conceptualize people with these diagnoses. Personality disorders reflect a disturbance in someone's personality or general pattern of behavior. Generally, all of us have parts of our personality that may cause disruptions in our life or conflicts with others. But most of the time, we might be aware of it and be able to rein it in around certain people or in certain circumstances. The same is not true for people with personality disorders. These symptoms are pervasive and inflexible. This means that they act this way in all situations and contexts. As an example, maybe an aspect of someone's personality is that they are extroverted and loud and outgoing. But that person can likely rein that in during class or in the library. Someone with a personality disorder would not be able to control their pattern of behavior in the same way. It is the same across time and context. Alongside this, it's important to keep in mind that personality disorders are stable over time. Personality, as I mentioned in the first lecture when I discussed temperament, implies a way of behaving that's stable. Therefore, personality disorders are much more stable across time than other disorders we've discussed in this class. Even many of the chronic disorders that we've covered in class tend to ebb and flow with regard to the severity of symptoms. That is not true for personality disorders. They are totally stable and don't cycle. That will be helpful to keep in mind in differentiating some of the personality disorders from some of the other disorders we've already discussed. Typically, personality disorders begin in adolescence or early adulthood. In fact, you'll see that for the majority of the personality disorders, it specifies in the criteria that symptoms must have been present by at least early adulthood. Therefore, a personality disorder would never newly develop in later adulthood. Finally, personality disorders tend to lead to distress or impairment for the person, though the experience of this will differ depending on the disorder. There are certain personality disorders for which the person definitely feels and experiences distress and wishes they could change. However, for others, they do not experience any distress at all and have no intent to change, though ultimately they're impaired in some way due to their behavior. There are 10 personality disorders and they are conceptualized in 3 clusters. Cluster A, which includes odd and eccentric disorders. Cluster B, which includes dramatic, emotional, and erratic disorders. And Cluster C, which includes fearful and avoidant disorders. We'll go through the disorders in this order. For most of these disorders, we will simply focus on the diagnostic criteria. We will only go into detail about etiology and treatment for borderline and antisocial personality disorder, since these are the 2 most researched personality disorders. We'll start first by discussing the 3 disorders in the odd and eccentric cluster. Clearly, people with these personality disorders will be seen as odd and eccentric. The first disorder is paranoid personality disorder. You'll see that for each of the disorders, there's a brief description of how the person acts, the important parts of which I have underlined, and all personality disorders will necessitate that symptoms begin by early adulthood, as I have italicized. For paranoid personality disorder, the person is pervasively paranoid. Specifically, they don't trust and are suspicious of others, even family members or friends they have known for years, and their spouse or partner. They have no evidence to suggest that others are deceiving them, at least no objective evidence. Though people with paranoid personality disorder will tend to perceive threats where there really are none, or perceive that others are deliberately annoying them when no one else would ever think that way. For instance, someone with paranoid personality disorder may believe that the neighbor's dog is barking because the neighbor specifically wants to keep him up at night or annoy him. Or they might perceive a cashier's honest mistake when giving them change as a deliberate attempt to shortchange them. They also tend to misinterpret neutral or innocuous interactions as critical of them. For example, when given a compliment, they may believe that the person is being sarcastic and is actually trying to criticize them. Or they may interpret a genuine offer of help as criticism of their ability. When they believe someone has been doing something to harm them, They are quick to react angrily and will often remain angry and bear grudges for some time. Clearly, relationships are difficult for people with paranoid personality disorder, since they are constantly suspicious of everyone. They read threats when there are none, and won't even let themselves get very close to others or share personal information with others because they're afraid that they'll use that information to exploit or harm them. For this diagnosis, the person needs to display at least 4 of these 7 symptoms. Paranoid personality disorder may look similar to schizophrenia or another psychotic disorder like delusional disorder. There are a few important things to keep in mind when differentiating these disorders. First, paranoid personality disorder does not include true delusions. The person suspects that they're being harmed or deceived, but they're willing to at least entertain the possibility that it might not be true. So they are not truly delusional. Although one of the criteria for paranoid personality disorder is that the person suspects that their sexual partner is not being faithful, which sounds like delusional disorder, jealous type. Again, for this disorder, it's simply a suspicion. They're not absolutely convinced that their partner is cheating on them, which would be the case for delusional disorder. That is one way to separate out paranoid personality disorder from a psychotic disorder. Another major difference will be with regard to the stability of the symptoms. Schizophrenia is a cyclical disorder. Their delusions and paranoia will come and go. The same is not true for paranoid personality disorder. Remember, personality disorders are stable over time, so there will be no ebb and flow regarding the existence of their paranoia. To give an example of someone with paranoid personality disorder, it's been speculated that some historical figures like Hitler, Stalin, and Saddam Hussein may have demonstrated at least some symptoms of this disorder, constantly feeling like everyone is out to get them, trusting few people, and being suspicious of others' motives. The next disorder is schizoid personality disorder. People with this disorder do not want social relationships of any kind. They are completely uninterested in other people, as well as indifferent to them. These individuals will choose a lifestyle and occupation that allows them to be alone. They will work at home, they will stay home alone most of the time, they won't get married, and they will try to avoid interactions with others, including their family, as much as possible. They don't experience much enjoyment out of life, even when doing things that others would find inherently pleasurable, like having sex. Whereas most of us feel good when we're praised and feel disappointed, or rejected or bad when we're criticized, individuals with schizoid personality disorder do not experience any of those emotions in response to the feedback of others. They are completely unaffected by it. This comes back to the lack of interest in interpersonal relationships. Most people tend to feel good when praised and bad when criticized because we care about what others think of us because we're invested in relationships with others. Since people with schizoid personality disorder are not invested in relationships, praise or criticism from others does not matter to them. In general, they show flattened affect, where they don't display much positive or negative emotion, though they may appear cold and detached. So in sum, these individuals do not have relationships with others because they simply don't want them, and are entirely indifferent to how others feel about them, and need to display at least 4 symptoms to indicate this. In thinking of examples of people or characters with schizoid personality disorder, you could argue that Dexter Morgan, particularly earlier in the series, shows symptoms of this disorder. Others have argued that Batman does as well. Finally, Squidward from SpongeBob SquarePants also shows some symptoms. The last disorder in Cluster A is schizotypal personality disorder. Do not get this one confused with schizoid personality disorder. People with schizoid personality disorder do not want relationships, while people with schizotypal personality disorder are extremely odd and bizarre, sort of like a mild form or type of schizophrenia. You'll see that I'll make a lot of comparisons between symptoms of schizophrenia and symptoms of schizotypal personality disorder. Many are similar, though those relevant to this disorder are not quite as severe as those for schizophrenia. People with schizotypal personality disorder appear very unusual in their manner of speech and in their behavior or appearance. They may have ideas of reference, which are different from delusions of reference because these aren't firmly held fixed beliefs. So, just like I was mentioning in the differentiation between paranoid personality disorder and schizophrenia, the same is true here in that people with schizotypal personality disorder are not truly delusional. Specifically, delusions of reference are exclusionary for this disorder, meaning that if these thoughts of reference were firmly held and fixed, the person would not have schizotypal personality disorder, and instead would likely have a psychotic disorder. People with schizotypal personality disorder may think that conversations or gestures of others have some special meaning or personal significance for them, but they're able to acknowledge that that might not be true. They tend to have a lot of magical thinking where they think that their actions may actually affect others or produce certain outcomes, even if they're not related. For example, do you remember that saying that if you step on a crack, it will break your mother's back? People with schizotypal personality disorder may actually think something like that and will alter their behavior to make sure that they never step on a crack. In other words, they tend to be pretty superstitious. They may also have clairvoyant thoughts where they feel like they can predict the future. They may report unusual perceptual experiences, but not to the level of hallucinations. For example, they may have bodily illusions, which means that they feel or sense that someone else may be in the room, though they're not hallucinating and that they don't actually experience someone else being in the room. Their speech is odd, and they may say things that just seem off or unusual, but they're not demonstrating quite the disorganized pattern of speech that we would see in schizophrenia. Their behavior may be odd because they may do things like mumble to themselves, dress in several layers of clothes even though it's very hot outside, or demonstrate inappropriate affect, where they display an emotion that's inappropriate for the context. On the other hand, they may display constricted affect or emotions that are abnormally constrained. They may only ever seem a little happy or a little sad, but their ability to experience a wide range of emotions is limited. Similar to paranoid personality disorder, they tend to be fairly suspicious of others, which combined with their odd behavior results in them having very few friends or social contacts. They appear very uncomfortable around most other people, largely because of their paranoia, rather than anxiety. So altogether, for this diagnosis, the person needs to display at least 5 of 9 symptoms. In thinking about people or characters with this disorder, some examples could be Willy Wonka or Kramer from Seinfeld. We'll now discuss the 4 cluster B disorders, which largely involve people who are dramatic and emotional. The first is histrionic personality disorder, where people are highly attention-seeking. They will do anything to be the center of attention and are extremely uncomfortable if everyone isn't paying attention to them. In order to get this attention from others, people with histrionic personality disorder will go to great lengths, such as behaving and dressing extremely provocatively or sexually. They also appear to be highly, though theatrically, emotional. They may cry uncontrollably at a sad movie or be kind of over the top with their profession of how much they love someone, even if they just met them. Again, this is done simply to get others' attention. They often consider relationships to be closer than they actually are. For instance, proclaiming that someone they just met is their dear friend. People with histrionic personality disorder often seek approval and reassurance from others and are highly suggestible, meaning influenced by others. They may alter their interest or beliefs based on what others are saying, again, to continue to draw attention to themselves. Finally, their speech is likely to be highly emotional in nature, but also vague in general. For instance, if someone with histrionic personality disorder was asked about how their first date went, they might say, "Oh, it was way cool," but then fail to elaborate or say anything else. They appear really shallow to others since their emotions and behaviors are apt to change instantly, all in an effort to draw attention to themselves. Basically, their dress, their verbalizations, and their actions are all done in an attempt to make sure everyone is paying attention to them. For the diagnosis, the person needs to display at least 5 of the symptoms. Examples of someone with histrionic personality disorder include many people on reality TV shows, or Derek Zoolander, or Regina George from Mean Girls. The next disorder is narcissistic personality disorder. If you know what a narcissist is, then you have a pretty good idea about this diagnosis. In this disorder, people have a need for admiration from others because they view themselves as being extremely important or gifted or successful in some way and want to make sure that everyone else recognizes that. Though people with narcissistic personality disorder want everyone to recognize their greatness, they only actually wish to associate with people of their caliber because they believe that only other special or successful people can truly understand them. In truth, they are so arrogant and preoccupied with themselves that they lack understanding and empathy for others, and may say or do things to others that upset them, but they are not even able to realize it. Additionally, in order to achieve their own goals, they will often exploit or take advantage of others. They are entitled, believing that they are deserving of all sorts of things because of their greatness. For all of these reasons, social relationships will be difficult with people with narcissistic personality disorder because they behave in ways that make other people not like them. Finally, people with narcissistic personality disorder have difficulty with defeat or when other people are actually better than them. Though they only wish to associate with successful people, they become extremely jealous of others when they prove to be objectively more successful or intelligent. For the diagnosis, the person must display at least 5 of the symptoms. In thinking about examples of people with narcissistic personality disorder, some options may be Sheldon Cooper from Big Bang Theory, or Gregory House from the show House, or honestly, Donald Trump. Probably the best studied personality disorder is borderline personality disorder. People with borderline personality disorder have difficulties maintaining interpersonal relationships and have unstable mood and thoughts about their self-image and impulsivity. Let's first discuss problems with interpersonal relationships. People with borderline personality disorder tend to have a lot of all or nothing or black or white cognitive distortions. When it comes to other people, people are either all good or all bad. Thus, people with borderline personality disorder often experience alternating feelings of idealization and de-evaluation towards other people. What this means is that upon meeting a new person, they may put them on a pedestal and idealize them, expecting them to be perfect. However, no one can live up to those standards, so the person will ultimately do something wrong. Because one thing was done wrong, this means that the person is no longer perfect. Thus, they must be bad. So now the person with borderline personality disorder starts devaluing them and disliking them. People with borderline personality disorder may cycle through this many times with different people. However, on top of this, they are highly afraid of abandonment. Even if there is not evidence that a friend or partner is going to leave them, they may often become afraid that they will leave and they will engage in frantic efforts to get the person to stay, doing anything and everything they can, which may oftentimes be perceived as manipulative. For these reasons, and also because of the other symptoms I'll discuss in a few seconds, people with borderline personality disorder have difficulty maintaining social relationships for any period of time. Next, people with borderline personality disorder have a disturbance in their self-image. They don't quite know who they are or who they want to be, frequently changing their mind on career goals or even their own personal beliefs and values. They may even be confused about their sexual orientation or other usually well-known and understood parts of ourselves. They are also extremely impulsive in multiple separate areas, including engaging in dangerous or reckless behavior, drug and alcohol use, gambling, binge eating and purging behavior, and self-harm behavior, just to name a few. Many people with borderline personality disorder attempt suicide or engage in self-harm or self-mutilation behavior, such as cutting themselves. This is not always done to commit suicide. It may be done to communicate their pain to others. It may be done to prevent others from leaving or abandoning them, and it may be done because they would rather experience physical pain than emotional pain. The major underlying problem for people with borderline personality disorder is thought to be that they cannot handle or deal with negative emotions, which causes them problems in all of these other areas. They don't know how to deal with their negative affect, so they may cut themselves to feel physical pain instead. So this brings us to discussing the problems with unstable mood or emotions that people with borderline personality disorder have. They may quickly swing from one mood state to the next, and it takes them longer than most to return back to a neutral mood. Thus, if they get extremely sad and depressed, it takes a long time for them to come back to normal. They tend to easily become extremely angered, and they may also report feeling chronically bored or empty, including feeling emotionally numb. Finally, when people with borderline personality disorder experience negative mood states and stress, they may begin to experience transient or temporary paranoia, or they may disassociate and either not remember certain periods of time or may experience transient symptoms of feeling like they are outside of their body, or like their body is mechanical, or like the world around them is not real. So, altogether, the person needs to display at least 5 symptoms for this diagnosis. Examples of potential characters with borderline personality disorder include Mickey from the Netflix show Love, or Rebecca from Crazy Ex-Girlfriend, or potentially Anakin Skywalker. Borderline is more common among women, and people with borderline personality disorder are very likely to be diagnosed with at least one other disorder as well, predominantly a mood, anxiety, eating, or substance use disorder. About 10% will attempt suicide, and another 8% will be successful in completing. Interestingly, symptoms of borderline personality disorder tend to get better after the age of 40. It's likely that their mood instability and impulsivity symptoms decrease, which result in fewer suicidal and self-harm behaviors and a general improvement in their functioning. However, from the time at which they start experiencing these symptoms, likely in adolescence, until age 40 or so, symptoms are persistently stable and pervasive, and they will always have a tendency towards negative mood and impulsivity. Please watch the video to listen to a woman with borderline personality disorder discuss her symptoms. This will be posted in a handout in the module section. Borderline personality disorder is thought to be at least partly biological in nature, specifically that the person has inherited traits of affective instability and impulsivity. These are key symptoms of people with borderline, so it makes sense that inheriting high levels of emotional instability and impulsivity are core etiological factors for this disorder. People with borderline personality disorder also show decreases in their serotonin levels. In terms of psychological causal factors, people with borderline personality disorder are more likely to have experienced numerous negative and traumatic events in childhood, such as being neglected or abused, which may interact with biological predispositions in the development of borderline personality disorder. Additionally, it's thought that people with borderline were raised in an invalidating environment where their emotions were not taken seriously by others. Because of this, they had to learn extreme ways to communicate one's needs. For example, by engaging in self-harm behaviors, because their mood and wants were not taken seriously. Medications may be prescribed for individuals with borderline personality disorder, but they are only mildly effective and only treat specific symptoms of the disorder, not the disorder overall. Mood stabilizers, like those prescribed for bipolar disorder, may be prescribed to help with irritability and aggression. SSRIs may be prescribed to help with anger, anxiety, and mood shifts. Antipsychotics may be prescribed if the person is experiencing transient psychotic symptoms. A psychological treatment called dialectical behavior therapy, or DBT, was developed specifically for the treatment of borderline personality disorder, though it's actually since been applied to the treatment of a variety of disorders. This treatment is based on the conceptualization that the core problem of people with borderline personality disorder is their inability to deal with negative emotions. Thus, the goal of the treatment is to teach patients ways to better accept and handle their negative mood states, without resorting to disruptive and potentially life-threatening behavior. The first goal of treatment is to get the patient to stop engaging in suicidal and self-harm behavior. We need to keep the person alive in order to effectively treat them. Essentially, the therapist will not be able to do anything for the client if the client is not alive. It's really that simple. Thus, the client must commit to not engaging in self-harm behavior. Once that is no longer a concern, treatment focuses on decreasing behaviors that interfere with therapy and escapist behaviors, such as not showing up for scheduled therapy sessions or engaging in other impulsive or manipulative behaviors. Finally, the person is then taught skills to improve their quality of life and to better regulate their emotions, increase interpersonal skills, and increase their tolerance for experiencing negative moods. Emotion regulation can involve practicing mindfulness and naming an emotion and letting it go, rather than dwelling on it. Interpersonal effectiveness skills can involve learning to assert one's wishes in an appropriate way while understanding others' points of view and that desires may need to be negotiated. Distress tolerance skills may include distraction techniques and learning to self-soothe in times of negative emotion. During this therapy, the therapist takes an accepting approach with the patient, and that the therapist accepts the patient for who she is and accepts that behaviors, such as cutting, are part of the person's disorder, though the therapist takes a firm stance that they don't approve of the patient engaging in cutting behavior. True DBT is an extremely time-consuming treatment, both for the patient and the therapist. The patient is involved in both individual and group therapy on a weekly basis. The therapist is also available to the patient 24 hours a day. This is done to ensure the safety of the patient and also to validate her experiences. If the patient is feeling suicidal and needs help coping with the feelings so that she can remain safe, she can page the therapist, who is on call at all hours of the day, who will call back and walk the patient through her tough time. Remember, it's thought that individuals with borderline have learned to communicate their needs and emotions in extreme ways, because that's the only way someone will take them seriously. If the therapist is always available for the patient doesn't need to resort to these extreme behaviors, making it less likely that they'll harm themselves. Because people with borderline can be manipulative of others, there are strict rules surrounding this contact policy, and that if the patient contacts the therapist outside of the scheduled sessions, there's then a mandatory period of time in which the person is not allowed to contact the therapist afterwards. However, many treatment providers provide a sort of DBT-like treatment where they may not be available to contact at all hours of the day, or where the patient may only engage in individual or group therapy, but not both. However, the focus remains the same. The final cluster B disorder is antisocial personality disorder. People with this disorder are what society usually terms psychopaths or sociopaths. They have a persistent disregard for laws of society or for the rights of others, and that they repeatedly engage in behavior that could get them arrested if they were caught, or that harm others, being extremely deceitful, such as conning others or repeatedly lying, and being consistently irresponsible, such as not working or honoring obligations. They also tend to be highly impulsive and aggressive, and have no concern or regard for their own safety or that of others. When people with antisocial personality disorder do things that harm others, they do not exhibit any remorse. In fact, many say that they would do it again. For the diagnosis of antisocial personality disorder, they must be at least 18 years old. This is the only personality disorder that has a specific age criterion associated with it. Whereas all of the other personality disorders state that the symptoms must be present by early adulthood, antisocial personality disorder specifies an early age and that symptoms must be present by age 15. Additionally, there needs to be evidence that the person was or could have been diagnosed with conduct disorder in childhood, which is essentially the kid version of antisocial personality disorder. It's diagnosed in kids who violate age-appropriate rules of society and rights of others. So antisocial personality disorder requires clear evidence of a history, starting in childhood, of this pattern of violating the rights of others and rules of society. Examples of characters or people with antisocial personality disorder include the Joker, many serial killers, or possibly the Grinch. Antisocial personality disorder is more common among men than women, and it is also common among individuals in prison, which makes sense since one of the criteria specifies that they repeatedly do things that are grounds for arrest. However, there are also many individuals in prison without this diagnosis. Criminal behavior alone is not sufficient for this diagnosis. If you remember from when we discussed somatic symptom disorders, I mentioned that somatic symptom disorder appears to be genetically related to antisocial personality disorder, likely through the inherited trait of impulsivity. Another biological etiological factor is that the reward system of people with antisocial personality disorder is overactive, meaning that they are more likely to seek out reward and may be more sensitive to reward and related cues, while their behavioral inhibition system, which is responsible for slowing down or inhibiting our responses when faced with a punishing or novel situation, is underactive. Thus, they are biologically more driven to seek reward and are not deterred or slowed down by possible punishing situations. Another theory, the underarousal hypothesis, suggests that people with antisocial personality disorder start off at a lower baseline level of arousal than most people. So they need to engage in very risky behavior to achieve an optimal level of arousal. The Yerkes-Dodson curve helps depict our optimal arousal where we function, perform, and feel our best. We aim to be aroused to the point where we function best, which is right in the middle of this curve. If we're too under-aroused or over-aroused, we don't feel or perform or function at our best. For most people, our baseline arousal is just slightly less than our optimal arousal. So we might take a mild stimulant like caffeine or do something moderately exciting to get our level of arousal up a bit so that we can achieve our optimal level. But if we drank too much caffeine or did something very risky, it would push our level of arousal way over to the right on the curve, which would interfere with our performance. Thus, most people don't want to engage in super risky behavior because then we wouldn't feel or perform well. For example, engaging in illegal or assaultive behavior would way over-arouse most people, and they wouldn't end up feeling or performing well. However, it's thought that people with ASPD start much lower on this curve as baseline, such that they actually need to engage in very risky behaviors to increase their level of arousal up to the optimal level. Simply doing something only moderately thrilling would only push them slightly to the right of the curve, and they're still not optimally aroused. Thus, they need to do something much more extreme to feel and perform their best. The next etiological hypothesis is the fearlessness hypothesis. This theory states that people with antisocial personality disorder just do not experience physiological symptoms of fear in the same way that most people do. We are often discouraged from engaging in very risky behaviors because we don't like the feelings that we have when we're afraid, like sweating and racing heart. Most people simply don't like to truly feel scared. People with antisocial personality disorder aren't deterred from risky behaviors because they don't experience those same fear symptoms, even in the face of very scary situations. The last theory involves inconsistent parental discipline. It is thought that the parents of kids who later grew up to have antisocial personality disorder showed inconsistent discipline, such that the kid never actually learned right from wrong and never learned that bad behavior is associated with negative or aversive consequences. As I already mentioned when we discussed the diagnostic criteria, there must be evidence of conduct disorder in childhood for the diagnosis of antisocial personality disorder. However, particularly early evidence of conduct disorder, specifically prior to age 10, is especially predictive for later antisocial personality disorder. Having other childhood disorders like ADHD is also associated with increasing the chance of developing antisocial personality disorder. Treatment for antisocial personality disorder is very difficult. Pretty much the only time someone would be in treatment for antisocial personality disorder would be if they were court-ordered or in jail, because they do not want to change their behavior and aren't distressed by their actions. Remember, they don't experience remorse, so they are highly unlikely to seek treatment on their own. Typical treatment that is applied to many criminals, such as trying to enhance their empathy for others and teaching them social skills, is actually detrimental because it actually just helps improve their deceitful and manipulative behaviors. Most people with antisocial personality disorder are actually very good at charming and manipulating others, and that's how they get away with a lot of their behavior. So teaching them these skills will only serve to help promote and get away with their behaviors. However, similar to borderline personality disorder, after about the age of 40, antisocial behavior tends to decrease. This could be due to a few reasons. It could be that the person sort of burns out on the risky and aggressive behavior at that time and stops engaging in it as they get older. It could also be that they just get better at getting away with and hiding their antisocial behavior, so it looks like there are fewer cases in the population, but really, they're just never recognized. Finally, it could be that the more extreme cases are eliminated from the population by that time, either by being imprisoned or being killed as a result of their behavior. Even though treatment has not been shown to be very effective, there are still attempts made to try to improve their symptoms and behavior. There has been little research conducted on whether or not medications are effective for antisocial personality disorder, but it seems as though they may improve a few of the individual symptoms, like irritability or aggression, but not the disorder as a whole. CBT is the treatment that's most often applied. It involves teaching the person to try to increase their self-control so that they're less likely to act impulsively and anger management to try to control their aggressive behaviors. To effectively utilize CBT, the person needs to be in a controlled setting like prison, since otherwise they will not engage with treatment. Unfortunately, even when improvements from CBT are seen among individuals in prison, there's little evidence that suggests that these gains are maintained if and when they are later released back into the public. It's more likely that they will resort back to their old pattern of behavior. We'll now move on to discuss the last three personality disorders, which are in the anxious and avoidant cluster. The first disorder is avoidant personality disorder. In this disorder, people avoid social interactions and relationships, similar to schizoid personality disorder, but it's not done for the same reason. Whereas people with schizoid personality disorder do not want relationships and are indifferent to the praise or criticism of others, people with avoidant personality disorder are hypersensitive to criticism by others, which makes them avoid social interactions because they don't want to be rejected or criticized. So you see a lot of the same things here as with schizoid personality disorder, like avoiding occupations that require substantial social contact or being reluctant to fully engage in social or intimate relationships. But it's because they view themselves as inferior to others and are afraid that others will reject them, make fun of them, or criticize them. They view themselves as being entirely inadequate, inept, and inferior to others. So they are so concerned that they will behave in some way that will cause others to dislike them or criticize them, so they remove that possibility by just avoiding relationships. Essentially, they have no relationships because that's the only way that they can be sure that they won't be criticized or negatively evaluated. They would actually like to have relationships, but their sensitivity to criticism and inadequacy prevents them from having relationships. It's difficult to think of good examples of characters with this disorder because it is difficult to depict them in the media. Avoidant personality disorder is equally common among men and women. Again, I just want to highlight the difference between avoidant and schizoid personality disorders. Both of them avoid social interactions and relationships, but schizoid does it because they don't want relationships and are indifferent to others' perceptions of them, while people with avoidant personality disorder wish they could have relationships but are too afraid of being rejected or criticized. Avoidant personality disorder is also conceptualized to be a more severe version of social phobia. Remember, in social anxiety disorder, people are highly anxious about social or performance situations, which causes those people to try to avoid those situations. However, they still function in other areas of their life that include social interaction. They still tend to spend time socially with others. It's just that they are anxious when engaging in a very specific behavior around others, such as speaking or eating in front of groups of people. In avoidant personality disorder, all areas of life that include any social interaction, not just ones where they believe that they will be evaluated or exposed to unfamiliar people, as is the case for social anxiety disorder, are impaired and are a cause for concern. The next disorder is dependent personality disorder. In this disorder, people have an extreme need to be cared for and fear of separation or abandonment, specifically because the person fears she cannot care for and support herself if that happens. People with this disorder are highly submissive, agreeing to do whatever everyone else wants, and will even submit to doing unpleasant activities like cleaning someone else's house in order to gain approval from others. They also have difficulty making even simple decisions, such as where to go eat, or what clothing to wear, or what movie to see, without excessive advice and reassurance from others. They both feel that they can't make these decisions on their own, but they also want to make others happy so that they will remain in a relationship with them and continue supporting and nurturing them. If they are concerned that a relationship may end, they will immediately attempt to find a new relationship and source of support so that they don't have to be by themselves. When they are alone, they feel extremely helpless. There is some overlap between dependent personality disorder and other disorders, including borderline personality disorder and separation anxiety disorder. In both dependent and borderline personality disorders, the individual may go to great lengths to prevent another person from leaving the relationship. Some differences between the disorders, though, are that borderline personality disorder will include unstable mood symptoms, likely involving anger that may be directed toward the individual. And remember that people with borderline personality disorder alternate between idealizing and devaluing others. People with dependent personality disorder do not have unstable mood and would be very unlikely to lash out at others. Instead, they do not get appropriately angry with others due to fear of alienating them. Further, the specific reason that people with dependent personality disorder are seeking relationships is because they feel inept and unable to function on their own. This is not a concern for people with borderline personality disorder. This is a similar difference with separation anxiety disorder. Both that disorder and dependent personality disorder fear separation from others. But people with separation anxiety disorder do not fear the separation because of lack of efficacy to support themselves. They fear separation because they are afraid harm will befall the other individual. Finally, I also want to note that both dependent personality disorder and avoidant personality disorder have in common concerns with ineptitude, but they express this concern in opposite ways. People with avoidant personality disorder believe they are inept and inferior, so they avoid all relationships to avoid criticism, while people with dependent personality disorder believe they are inept and so seek out relationships so that they can be cared for. An example of a character demonstrating symptoms of dependent personality disorder is Buster Bluth from Arrested Development. The last personality disorder is obsessive compulsive personality disorder. This disorder is different from OCD. It does not include obsessions and compulsions. Instead, OCPD is actually how many people colloquially talk about OCD. You've probably heard people say, or perhaps you've said yourself, that someone is so OCD because they need things done in a certain way or are very particular. When someone says that, what they actually mean is that they are displaying symptoms of OCPD, not OCD. In OCD, people perform compulsions to take away the anxiety caused by an obsession. In obsessive compulsive personality disorder, or OCPD, people demonstrate orderliness, perfectionism, and inflexibility because those are the pervasive personality characteristics that they demonstrate. So people with OCPD are excessively preoccupied with things needing to be ordered or arranged or done in a certain way. So much so that the overall point of the activity is lost. The saying, losing the forest through the trees, is a perfect example of this. They may be working on some project for work, but they get so hung up on how the spreadsheet should be organized that they completely forget about the point of the spreadsheet, which was to complete a project. Related to this, they often slow down task completion because they insist that everything be so perfect, and they spend so much time making sure that things are perfect that it takes them a long time to actually get things done. It's not just to say that individuals with OCPD are perfectionists. Many people have perfectionistic qualities, but this need for perfectionism doesn't drive their daily life and interfere with their functioning, as it does for people with OCPD. These individuals are completely devoted to work in their life to the exclusion of other activities. They forego meaningful relationships and recreational activities because they are so devoted to work. But ironically, they get very little completed. Even when they do engage in recreational activities, the focus on perfect performance remains. They also feel the need to do pretty much everything themselves, rather than delegate to others, because they are so concerned that others won't complete the task in the appropriate or perfect way. They are rigid and stubborn about most things in life. In particular, they tend to rigidly adhere to rules and authority, insisting on strict adherence and compliance with rules with no allowance for rule bending due to extenuating circumstances. They also are miserly pinch pennies and are reluctant to discard items, even if they are old and have no monetary or sentimental value. Again, Sheldon from Big Bang Theory is an example of a character who demonstrates many of these traits. The remaining slides include the What's the Disorder activity. Please identify which personality disorder each of these cases appears to be describing, and let me know if you'd like to check your answers or if you have any questions. Donna danced into the party and immediately became the center of attention. With sweeping gestures of her arms and dramatic displays of emotion, she boasted about her career as an actress in a local theater group. During a private conversation, a friend inquired about the rumors that she was having some difficulties in her marriage. In an outburst of anger, she denied any problems and claimed that her marriage was as wonderful and charming as ever. Shortly thereafter, while drinking her second martini, she fainted and had to be taken home. William wandered into the party, but didn't stay long. The negative forces in the room were unsettling to his psychic soul spot. The few guests he spoke to felt somewhat uneasy being with this aloof space cadet. Sherry paraded into the party drunk and continued to drink throughout the night. Laughing and giggling, she flirted with many of the men, and to two of them expressed her deep affection. Twice during the evening, she disappeared for almost half an hour, each time with a different man. After a violent argument with one of them, because he took too long to get her a drink, she locked herself into the bathroom and attempted to swallow a bottle of aspirin. Her friends encouraged her to go home, but she was afraid to be alone in her apartment. Winston spent most of the time talking about his trip to Europe, his new Mercedes, and his favorite French restaurants. People seemed bored being around him, but he kept right on talking. When he made a critical remark about how one of the women was dressed and hurt her feelings, he could not apologize for his obvious blunder. He tried to talk his way around it and even seemed to be blaming her for being upset. Peter arrived at the party exactly on time. He made a point of speaking to every guest for 5 minutes. He talked mostly about technology and finance and avoided any inquiries about his feelings or personal life. He left precisely at 10 p.m. because he had work to do at home. Before entering, Doreen watched the party for several minutes from outside through the window. Once she went in, she seemed very uncomfortable. When people tried to be nice to her, she looked guarded and distrustful. People quickly became uncomfortable with her habit of finding fault with every little thing they said or did. She seemed to be picking fights with people. She didn't stay very long at the party. Amanda was invited to the party but didn't come. She tries to avoid social interactions most of the time because she is afraid that people won't like her. She spent the whole night thinking about the party and wishing she was there. Harold wasn't invited to the party, but he was not bothered by this. No one really knows him very well because he rarely talks to other people and goes out of his way to avoid other people. He prefers to spend his time at home alone. Tamara was invited to the party but ultimately ended up not going. When Tamara got the invitation, she repeatedly asked her friend Lisa if she should go to the party, what she should wear, and if she should bring anything. When Lisa wasn't able to make it to the party at the last minute because she had to clean her house, Tamara decided not to attend the party either. When Lisa asked Tamara to help clean her house, Tamara agreed and ended up doing most of the cleaning. Duncan arrived at the party intoxicated. He immediately started a physical fight with one of the male guests, and when he accidentally seriously hurt a young woman at the party, he did not apologize or seem sorry. When the party host asked Duncan to pay for damages sustained to her house following the fight, Duncan refused.